advice to a young person embarking on a career in public health would be to engage in it with all your heart, because it's a fabulous time for public health in Canada. We really have a wonderful opportunity ahead of us. The challenges are immense, but at the same time, we're seeing movement going on in this country that we have not seen for a long time. We're seeing anti-poverty programs being brought in many parts of the country. Unfortunately, it's not universal, but it is happening. The political decisions are beginning to catch up with the values of Canadians. People do believe in social justice. They do believe in reducing health inequities. And there's a huge role to be played by public health professionals.
I think my biggest failure as a professional in development has perhaps been to not pay sufficient attention to the younger generation. I think my generation, coming out of the 1960s and 70s, was a very idealistic generation. And I think we've taken up a lot of space. And we have not always created space for the next generation, which is equally as idealistic. I think the opportunities are endless. I think, again, coming to the international development area that I have worked in, I think they have to learn a lot about other countries, other approaches. As they embark on their career, as I did at the beginning of my career, I thought I knew lots of things. Took a little while for me, probably a few years for me to understand that there were huge knowledge gaps that could only be filled by working in the trenches. I think a lot of young people today in international work often think of their career as at a very high level, and I always encourage them to get into the community, to get their feet wet and learn at that level. And that experience early in their career will give them a tremendous foundation on which to build their future aspirations.
Public health is a career that opens up so many opportunities for people. And looking back at it, I've been very fortunate. It's been a tremendous privilege for me to be involved in the issues that I've been involved with, to work with the people I've worked with. And if you can find that in any career, whether it's in public health or elsewhere, it is a real privilege. It's something to be savored. And hopefully we can all look back and say, I might not have been perfect, might not have got it right all the time, but I did what I could.
You should find a mentor. And you need to have an openness to, when the mentors are always kind of coming through our life, a lot of times we just can't see that. They're sort of invisible. So how are you going to create a receptivity that you can be sort of visible for a mentor? And essentially the mentor is like, it's a car that looks like it knows where it's going, and you should follow that mentor.
The great opportunities there are in public health, more than anything else, to bring together so many different viewpoints, so many different kinds of expertise, both the things we think of as typically health expertise, but also all the other bits and pieces, the way it fits together with our concerns about social services and, poverty and inequity. And I think it's a very exciting time from that point of view as we begin to understand how broad public health is and how comprehensive our approaches need to be.
For a young person embarking on a career in public health, be passionate, be committed, and have fun.
So whenever possible, I would encourage students certainly to leave Saskatchewan, preferably to leave Canada, and even more preferably to go and work in a developing country. And so over a course of several years, I placed 200 students in developing countries. And I think the majority of these learned more during the 3 or 4 months that they had in that sort of a situation they did in a whole year in Saskatoon. This didn't go over very well with the dean, who never really traveled very far. I'm not sure whether he even left the North American continent, because he felt, well, you know, how do we supervise these students when they're off in the Central African Republic? And it was a great pity because, you know, I recognize, and the students themselves recognize this was a valuable experience. They came back to Canada looking at Canada in a different way from the way they looked at it before they went overseas.
And I would say that to anyone who is just starting out: pursue public health with intelligence, courage, and a will to succeed.
I've advised a great many young people over the years, and I usually tailor the advice to the individual. In fact, I always do. But there's one general piece of advice that I give every youngster I meet, and I still meet quite a significant number of them, even now in my advanced old age. I still get to corrupt the minds of innocent young people often enough to get quite a lot of pleasure from doing this. The one piece of advice that is most important of all is to keep options open. Don't get too narrowly specialised too soon, so that it becomes difficult to turn your mind to other challenges as they evolve over time. Always maintain an open mind, always leave a large part of your mind free to embrace new ideas, new concepts, new discoveries, and have the flexibility to apply these in your own work as you go through your life.
Get a broad education in the disciplines that are relevant to public health. You know, don't just do epidemiology or don't just do microbiology. Learn as much social science as you possibly can, and probably certainly learn some administration. So try to get broad. Feel awfully good about yourself because you're going into such a socially useful field, but prepare yourself for a lot of deferred, or a lifetime of deferred gratification. Public health achievements are great, but they're slow.